Explain the physiological and anatomical differences between mice and rabbits that laboratory animal technicians should be aware of when handling these species. Answer: mice and rabbits, while both common laboratory animals, have several key physiological and anatomical differences that impact their handling and care. Mice are small rodents with a body mass of about 2040 grams. They have a high metabolic rate, meaning they need frequent feeding and can suffer from rapid dehydration. Their skin is thin, making them vulnerable to abrasions and infections. Mice are nocturnal, and their stress response can be heightened by bright lighting or excessive handling. Rabbits are lagomorphs and generally larger than mice, with a body mass ranging from 1–6 kilograms depending on the breed. Rabbits are prey animals with a strong flight response, so their handling should be gentle but firm to avoid injury from struggling. Rabbits also have very sensitive spines and can be injured easily by improper restraint, especially from sudden movements. Their gastrointestinal systems are more complex than mice, making them more prone to digestive issues like GI stasis if stressed or improperly handled. Key considerations for handling: mice are easier to restrain in small enclosures or by manual methods, e.g. scruffing, while rabbits require support under their hindquarters to prevent spinal injury. The risk of injury from rough handling is higher in rabbits due to their size and spine sensitivity. Relevance to guidelines: the NIH guidelines for the care and use of laboratory animals specify that animals should be handled in a manner that minimizes pain, distress, and injury. Both species require specific housing and environmental enrichment to reduce stress and promote their well-being. Describe the stress minimization techniques that should be implemented during the handling of non-human primates in a laboratory setting. Answer: stress minimization in non-human primate (NAPS) is crucial for both ethical and research reasons. Stress can affect animal health and the validity of experimental results. The following techniques should be used to reduce stress during handling. Proper training: NHPS should be trained to cooperate with handling procedures through positive reinforcement techniques, e.g. food rewards, which can minimize fear and anxiety. Gentle restraint: NHPS are strong and agile, so gentle, well-practiced restraint methods should be employed to avoid injury. Methods like the use of restraint chairs or harnesses and sedation when necessary should be considered. Environmental enrichment: providing objects that allow the NHPS to express normal behaviors, e.g. climbing structures, foraging items, can significantly reduce stress. Consistency: handling should be done by the same personnel, as NHPS can become stressed by unfamiliar humans. Consistency helps them adapt to the process and reduces anxiety. Minimizing noise and movement: loud noises and sudden movements should be avoided. The handling environment should be quiet, calm, and predictable. Mr. Thompson is a laboratory technician tasked with performing a routine health check on a group of laboratory rabbits. During the examination, he notices that one of the rabbits is showing signs of stress, such as rapid breathing, excessive vocalizations, and attempting to escape. Mr. Thompson has never encountered this level of stress in a rabbit before. What should Mr. Thompson do in this situation, and what factors should he consider to minimize the rabbit's distress while performing the necessary health check? Answer: in this scenario, Mr. Thompson should take several steps to minimize the rabbit's stress while ensuring the health check is completed effectively. Immediate assessment: Mr. Thompson should assess the rabbit for any obvious signs of injury or illness that may be contributing to the stress response. If the rabbit is in pain or discomfort, this should be addressed immediately, possibly with sedation or analgesias prescribed by a veterinarian. Restraint adjustment: rabbits have a strong flight response, so Mr. Thompson should ensure that the restraint is gentle but firm, avoiding any sudden movements. The rabbit's body should be supported, particularly the hindquarters, to prevent spinal injury. If Mr. Thompson is using a cage for the check, he should ensure that the cage is stable and not contributing to the animal's distress. Environmental modifications: stress can be exacerbated by bright lights or loud noises. Mr. Thompson should adjust the environment to be calm, dim the lights, and minimize noise. He may also move the rabbit to a quieter area of the laboratory if needed. Reassurance and familiarity: if possible, Mr. Thompson should ensure that a familiar technician handles the rabbit, as this can reduce anxiety. If a change in procedure is necessary, such as the introduction of a new restraint technique, Mr. Thompson should gradually acclimatize the rabbit to the new method to avoid sudden stress. Sedation: if the stress persists and is preventing the health check from being completed, Mr. Thompson may need to consult with the attending veterinarian to determine if mild sedation is appropriate for the procedure. Relevance to guidelines: the NIH and AWA guidelines emphasize minimizing stress in laboratory animals. Techniques like gradual desensitization, proper handling, and sedation where necessary are recommended for minimizing distress in rabbits. What are the best practices for identifying and marking laboratory animals to ensure proper tracking and prevent mix-ups? Answer: identification and marking of laboratory animals are crucial for maintaining accurate records and ensuring that animals are used in the correct experimental protocols. Best practices include ear tags and tattoos. For rodents, ear tags and tattoos are common methods of identification. Tattoos can be placed on the ear or the body, and ear tags can be used for larger animals. Microchipping. Microchipping is a permanent identification method that is used more commonly in larger animals like dogs and primates. The chip is inserted subcutaneously and can be scanned to retrieve an animal's identification number. Color-coded markings. Some researchers use non-toxic, temporary dye or markers for marking animals, e.g. colored inks or markers for fur or collars for larger animals. Record keeping. Every animal should have a detailed record that includes not just the identification method, but also information about the animal's species, age, health status, and any treatments or procedures it has undergone. These records must be updated regularly. Barcoding. In some facilities, barcode systems are employed for tracking animals. Each animal receives a unique barcode, and scanners are used for quick identification and tracking. What should be the primary considerations for a laboratory animal technician when applying restraint methods to non-human primates, and how should stress be minimized during the process? Answer: when applying restraint methods to non-human primates, the technician must ensure that the technique is safe for both the animal and the handler and that it minimizes stress to the animal as much as possible. The primary considerations include understanding the species behavior. Non-human primates are intelligent and social animals, which means they are sensitive to their environment and human interactions. The technician should be aware of the specific species' natural behaviors and temperament to choose an appropriate restraint technique. Choosing the right restraint method. There are various methods for restraining primates, including manual restraint, use of restraint chairs, and sedation. The method chosen should be based on the specific situation. Restraint chairs, for example, are commonly used in research to secure the animal without causing excessive stress, minimizing pain and discomfort. Restraint should never be so tight as to cause pain, injury, or respiratory difficulty. The technician should regularly check the animal's comfort level and adjust the restraint accordingly. Handling with care. Gentle, gradual techniques should be used, avoiding sudden movements that might startle the animal. Additionally, it is important to avoid unnecessary handling or extended periods of restraint. Environmental stress reduction. As with other species, the environment should be calm, quiet, and free from distractions or disturbances that may escalate stress. The technician should consider using environmental enrichment to help the animal stay calm during the procedure. Regulatory guidelines. The AWA and NIH guidelines for the care and use of laboratory animals both emphasize humane handling practices that reduce stress and injury. The IACUC must approve any procedures involving non-human primates to ensure that the restraint methods are ethical and appropriate. What are the challenges and best practices for ensuring the humane treatment of mice during laboratory experiments? Answer: ensuring humane treatment of mice in laboratory experiments presents several challenges, but best practices can help mitigate these issues. The challenges include handling stress. Mice are sensitive to handling, which can lead to stress responses. Techniques that minimize handling time and use positive reinforcement methods, such as food rewards, can help reduce anxiety. Minimizing pain and discomfort. Mice may be used in procedures that cause pain or discomfort. Best practices include using analgesics, anesthetics, or sedation to prevent or alleviate pain, and applying humane endpoints to ensure that animals are not subjected to unnecessary suffering. Housing and enrichment. Mice should be housed in conditions that promote their well-being, with sufficient space, nesting materials, and socialization opportunities if applicable. Environmental enrichment is critical to prevent boredom and reduce stress. Regulatory considerations. The NIH Guide and AWA guidelines are clear about the need to provide humane treatment, including the use of anesthesia or analgesia during painful procedures and ensuring that the animals are not subjected to unnecessary distress or discomfort. What specific health concerns should be monitored for guinea pigs in a research setting? Answer: guinea pigs, as common laboratory animals, require specific attention to their health needs. Vitamin C deficiency. Guinea pigs cannot synthesize vitamin C, so it must be provided in their diet to prevent scurvy. Deficiency symptoms include lethargy, swollen joints, and difficulty moving. Respiratory infections. Guinea pigs are prone to respiratory infections, particularly under stressful conditions or in overcrowded environments. Symptoms may include nasal discharge, wheezing, and labored breathing. Dental problems. Guinea pigs have continuously growing teeth. An improper diet or lack of chewable materials can lead to dental overgrowth, which can cause pain, difficulty eating, and abscess formation. Obesity. Guinea pigs are prone to obesity, particularly if they are overfed and not provided with adequate exercise or space for movement. Regulatory considerations. Proper veterinary care, preventive health programs, and appropriate diet are essential for guinea pig well-being as per AWA and NIH guidelines. How should laboratory technicians handle emergency situations involving animal safety, such as during a fire or natural disaster? Answer: emergency situations involving laboratory animals, such as a fire or natural disaster, require prompt and well-planned responses. Evacuation plan. Laboratory technicians should be familiar with the emergency evacuation plan that includes safe procedures for evacuating animals to designated shelters or areas within the facility. Animal transport. Safe transport methods should be in place for each species, with secure cages or carriers to prevent harm during transit. Preserving animal welfare. Once evacuated, animals should be monitored for stress and health concerns during the crisis. Veterinary staff should be available to manage any health issues that arise. Post-emergency protocol. After the event, animals should be assessed for injuries or illnesses caused by the emergency, and veterinary care should be provided as needed. Regulatory considerations. The AWA requires that laboratories have disaster response plans that include provisions for animal welfare during emergencies, ensuring that animals are not subjected to unnecessary harm. Describe the ethical considerations a laboratory animal technician must keep in mind when deciding on the use of animals in research. Answer: ethical considerations in animal research include Threer's principle. The technician must adhere to the Threer's principle: replace, reduce, and refine. This means replacing animal models with alternatives where possible, reducing the number of animals used, and refining experimental methods to minimize animal suffering. Informed consent. Although informed consent is not directly applicable to animals, researchers must ensure that animal use is justified and that protocols are reviewed by an IACUC to ensure ethical practices. Humane endpoints. If an animal shows signs of severe distress or health problems during an experiment, humane endpoints must be set to terminate the experiment early to prevent unnecessary suffering. Ongoing monitoring. Animals should be closely monitored for signs of pain, distress, or abnormal behavior throughout the experiment, with veterinary care provided as necessary. Guidelines. Ethical use of animals is mandated by regulations like the NIH Guide, AWA, and IACUC protocols. What are the key differences in anatomical and physiological characteristics between rats and guinea pigs that impact their care in a research setting? Answer: rats and guinea pigs differ in various ways that affect their care. Size and weight. Rats are generally smaller, with a weight of about 250,500 grams, while guinea pigs are larger, ranging from 700 grams to 1.2 kilograms. This affects their housing and handling requirements. Dietary needs. Guinea pigs need a continuous supply of vitamin C in their diet, unlike rats, which can synthesize vitamin C. This difference requires careful dietary planning to avoid deficiencies. Reproductive systems. Rats are polyestrous, having multiple estrous cycles, while guinea pigs have a specific reproductive cycle. This can influence breeding management in a research setting. Respiratory sensitivity. Guinea pigs are more susceptible to respiratory infections due to their limited ability to fight off infections, necessitating a more controlled environment. Regulatory considerations. Both species must be housed according to their specific needs as outlined in the AWA and NIH guidelines, which ensure humane care and minimize the risk of injury or illness. What are the primary ethical considerations when conducting animal research, and how do they relate to laboratory animal welfare legislation? Answer: ethical considerations in animal research revolve around ensuring the humane treatment of animals and minimizing unnecessary suffering. The Threer's replacement, reduction, and refinement serve as the fundamental ethical principles guiding laboratory animal science. Replacement suggests that animals should be replaced with non-animal alternatives wherever possible, e.g., cell cultures or computer models. Reduction means minimizing the number of animals used in experiments by using statistical methods to calculate the least number required for valid results. Refinement involves modifying experimental procedures to reduce pain and distress to animals, including improvements in housing, environmental enrichment, and anesthesia. These ethical considerations are underpinned by laws such as the Animal Welfare Act of RAP, which mandates humane care and treatment, and the Public Health Survey (PHS) policy, which requires institutions to follow humane guidelines for animal care in federally funded research. Furthermore, these principles ensure that animal use aligns with IACUC oversight to ensure compliance with ethical and regulatory standards. Describe the role and responsibilities of an Institutional Animal Care and Use Committee (ICUC) in laboratory animal research. Answer: the Institutional Animal Care and Use Committee (ICUC) is an essential body in overseeing animal research to ensure ethical compliance with regulations. The primary responsibilities of the IACUC are reviewing and approving research protocols. This includes assessing whether animal use is justified, the procedures are humane, and the 3Rs replacement, reduction, refinement are adhered to, monitoring animal care, ensuring that appropriate housing, veterinary care, and environmental conditions are provided, conducting inspections. The IACUC is responsible for inspecting animal facilities and ensuring that they comply with the regulations of the Animal Welfare Act and the PHS policy, ensuring compliance with regulations. This includes ensuring that animal research practices are in line with federal, state, and institutional guidelines. The IACUC also plays a role in investigating complaints of animal mistreatment. What factors must be considered when determining the appropriate housing and environmental conditions for laboratory animals? Answer: when determining housing and environmental conditions for laboratory animals, several factors must be considered to ensure their health and well-being. These factors include species-specific requirements. Different species have different needs for temperature, humidity, lighting, and cage types. For example, rodents often require room temperature of 2°C, whereas non-human primates may require higher temperatures. Cage size and type. Cages should be large enough to allow natural behaviors like movement and exploration. The material should be non-toxic and easy to clean. Cage types vary by species, with rodents requiring solid or wire cages and primates often housed in larger, more complex enclosures. Temperature and humidity control. Animals should be kept in a controlled environment where temperature and humidity are monitored to prevent stress and illness. For example, maintaining humidity between 30–70% is ideal for most laboratory species. Light cycles should mimic natural conditions, typically with a 12-hour light-dark cycle. This is important for regulating circadian rhythms. Ventilation. Adequate airflow is necessary to minimize the risk of airborne diseases and provide fresh air to animals. Mr. Jameson is responsible for setting up a new research lab that will house mice and rats. He wants to ensure that the animal's housing meets all required welfare standards. What should he consider when selecting the type of cage for these rodents, and how do environmental factors such as temperature and humidity affect them? Answer: Mr. Jameson should consider the following points: cage type. Mice and rats generally require solid bottom cages or cages with bedding for comfort and natural behavior. Wire cages can cause foot injuries or stress, so solid bottom cages are preferred. Size and space. The cage should provide enough space for the animals to move around freely, with sufficient room for nesting and exploratory behavior. According to the Guide for the Care and Use of Laboratory Animals, a minimum of 15 square inches per rat or mouse should be provided. Bedding material. Non-toxic bedding, such as shredded paper or aspen shavings, is essential for comfort, temperature regulation, and cleanliness. Temperature control. Rodents are typically kept at 2°C, and any deviation from this range can result in stress or health issues. For example, temperatures above 29 it can cause heat stress. Humidity control. Relative humidity should be maintained at 30–70% to prevent dehydration or respiratory distress. What are the primary nutritional considerations when planning the diet for laboratory rodents, and how do these considerations vary between species? Answer: nutritional considerations for laboratory rodents include basic nutritional requirements. Rodents require a balanced diet that includes proteins, fats, carbohydrates, vitamins, and minerals. The AAFCO guidelines for lab animals emphasize the importance of providing a complete diet that supports the specific metabolic needs of the species. Diet type. Most laboratory rodents are fed pelleted diets that are formulated to meet their dietary needs. Some specialized diets, such as liquid diets, may be required for specific research purposes or to address health conditions. Species-specific diets. Different species of rodents have different dietary needs. For example, mice and rats may have slightly different protein and carbohydrate requirements. Specialized diets, such as low-fat diets for obesity studies or high-protein diets for metabolic research, may be necessary. Water requirements. All rodents should have access to clean water at all times. Dehydration can quickly lead to health complications, especially in small mammals. The Guide for the Care and Use of Laboratory Animals provides detailed guidelines on proper diet formulation for laboratory rodents. Describe the most common methods for sexing laboratory rodents and the importance of accurate sex determination in research. Answer: sexing laboratory rodents is crucial to prevent inadvertent breeding or incorrect data interpretation due to sex-based physiological differences. The most common methods include visual inspection. This is the most commonly used method, involving the examination of the anogenital distance. Males typically have a larger distance between the anus and genitalia than females. Additionally, males may have visible genitalia, whereas females have a vulva. Palpation. In some cases, particularly with neonatal rodents, palpation may be necessary to distinguish males from females by feeling the testes. DNA analysis. This is used in cases where visual or physical examination is difficult, such as in genetically modified or very young animals. Accurate sex determination is essential for experimental design, especially when studying reproductive physiology, growth behavior, and pharmacokinetics, as male and female animals often exhibit different responses to drugs, diets, or environmental factors. What are the key factors involved in the breeding and genetic management of laboratory animals? Answer: key factors in breeding and genetic management include selection of breeding pairs. Careful selection of breeding pairs ensures genetic diversity and the maintenance of specific traits. Researchers should avoid inbreeding unless necessary for the study's goals, e.g. inbred strains. Genetic monitoring. Regular genetic testing should be performed to monitor the genetic health of the breeding colonies and to detect undesirable mutations or genetic drift. Culling and replacement. Animals that do not meet breeding or health standards may need to be culled. It is essential to replace breeding stock periodically to maintain genetic diversity. Environmentally induced changes. Environmental factors such as diet, housing, and stress can influence the genetics and behavior of offspring, so controlled breeding environments are necessary. The Guide for the Care and Use of Laboratory Animals provides further guidance on breeding and genetic management to ensure that breeding programs are ethical and effective. What are the key differences in the nutritional needs of neonates versus adult laboratory rodents? Answer: neonatal rodents have significantly different nutritional needs compared to adults. Milk and formula. Neonates rely on mother's milk for nutrition. In the absence of a lactating female, a suitable rodent milk formula is used to provide the necessary nutrients, as their digestive systems are not developed enough to handle solid foods. Growth and development. Neonates require high protein and fat content in their diet to support rapid growth and organ development. Adult rodents, on the other hand, require a more balanced diet with low fat content and a focus on maintenance, water, and hydration. Neonates may not be able to drink water from a bottle, so hydration is typically achieved through their mother's milk. Once weaned, they can transition to a more standard diet and water. The Guide for the Care and Use of Laboratory Animals outlines the appropriate care and feeding protocols for neonatal rodents to ensure their survival and development. Explain the concept of environmental enrichment in laboratory animal care and its importance in ensuring animal welfare. Answer: environmental enrichment involves providing laboratory animals with stimuli and opportunities to engage in natural behaviors to reduce stress, promote physical and psychological well-being, and prevent stereotypic behaviors, e.g. excessive grooming or pacing. Key elements include physical enrichment, providing objects like nesting materials, chew toys, tunnels, and exercise wheels to stimulate natural behaviors. Social enrichment, where possible, housing animals in groups, especially species that are social by nature, such as rodents, helps prevent isolation stress. Cognitive enrichment, introducing challenges like puzzle feeders or variations in the environment, encourages mental stimulation. Environmental enrichment is mandated by regulations such as the Animal Welfare Act and is recommended by the Guide for the Care and Use of Laboratory Animals to enhance animal welfare. What are the signs of distress or poor health in laboratory animals, and how should a technician respond to these signs? Answer: signs of distress or illness in laboratory animals may include behavioral changes, increased aggression, lethargy, or abnormal movement, e.g. circling or head tilting may indicate illness or stress. Physical symptoms, weight loss, labored breathing, ruffled fur, or signs of dehydration, e.g. sunken eyes or reduced skin elasticity, can indicate poor health. Changes in eating, drinking habits. A decreased appetite or excessive drinking urination may signal an underlying health issue. A technician should report any signs of distress or illness to the veterinary staff immediately and ensure that the animal receives appropriate care. The Animal Welfare Act requires that animals receive timely and adequate medical attention to prevent suffering. The IACUC plays a pivotal role in overseeing animal research to ensure compliance with ethical standards. What are the key responsibilities of the IACUC in reviewing and approving animal use protocols, and how does it balance ethical considerations with scientific necessity? Answer: the Institutional Animal Care and Use Committee (ICAC) is responsible for overseeing all aspects of animal research within an institution to ensure that animal welfare is maintained. The key responsibilities include protocol review. The IACUC reviews research protocols involving animal use, ensuring that animals are used in the most humane way possible and that alternatives to animal testing have been considered. Ethical review. The IACUC assesses whether the research design minimizes animal pain and distress while providing scientific value. This includes applying the 3Rs principle: replacement, reduction, refinement. Replacement: methods that avoid or replace the use of animals. Reduction: methods that minimize the number of animals used. Refinement: techniques that minimize the pain and distress of animals. Monitoring compliance. The IACUC ensures compliance with federal regulations such as the Animal Welfare Act and guidelines set by the National Institutes of Health (NIH), specifically the Guide for the Care and Use of Laboratory Animals. Inspection of facilities. The IACUC also monitors animal facilities for compliance with housing, care, and sanitation standards as per the USDA and NIH guidelines. In balancing scientific necessity with ethical considerations, the IACUC must ensure that any use of animals is scientifically justified and that there is no unnecessary harm to the animals involved. This process requires careful consideration of both the benefits of the research and the ethical treatment of animals. A pharmaceutical company is conducting preclinical trials involving laboratory animals for a new drug. How do the Good Laboratory Practice (GLP) and Good Clinical Practice (GCP) guidelines govern the use of animals in these trials, and what are the implications for researchers? Answer: Good Laboratory Practice (GLP) and Good Clinical Practice (GCP) are essential frameworks for ensuring the integrity and ethical treatment of animals in preclinical and clinical trials. GLP guidelines primarily focus on the conduct of laboratory studies, ensuring that data from animal trials are reliable and reproducible. For researchers, this means documenting procedures. Every step of the experiment, including animal care, experimental methods, and data collection, must be thoroughly documented. Animal welfare. GLP requires the use of appropriate facilities, qualified personnel, and proper animal care to ensure the animal's well-being throughout the study. Protocol approval. All animal studies must be approved by an IACUC before commencement, ensuring compliance with animal welfare laws, such as the Animal Welfare Act. EDCP guidelines apply more to clinical trials, but also affect preclinical animal studies by ensuring that ethical treatment. Animal studies conducted as part of clinical trials must comply with ethical standards similar to human clinical trials. This includes careful monitoring of animal welfare and minimizing pain and distress. Informed consent for humans. While animals cannot provide consent, researchers must ensure ethical justification for animal use and that alternatives are explored. The implications for researchers include ensuring that both GLP and GCP are followed meticulously, involving rigorous planning, documentation, and oversight with constant ethical evaluation of animal treatment. The use of the 3Rs principle: replacement, reduction, refinement has become a cornerstone of laboratory animal ethics. Explain how each of the 3Rs contributes to ethical animal research and provide examples of methods that illustrate each principle. Answer: the 3Rs principle is a framework aimed at reducing the ethical concerns related to animal testing. It stands for replacement, reduction, and refinement, each of which plays a critical role in promoting ethical animal research. Replacement: this refers to methods that replace the use of animals entirely, wherever possible. Examples include in vitro testing. Cell culture and tissue-based models can replace animal testing in many toxicology and pharmacology studies. Computer modeling. Advanced computational models can simulate biological processes and predict drug interactions without using animals. Reduction. This involves using fewer animals to obtain reliable results. Examples include statistical analysis, using statistical power analysis to determine the minimum number of animals required for a valid study, avoiding unnecessary use of animals. Multidisciplinary approaches, using data from various sources to reduce the need for repeated studies with animals. Refinement. This refers to modifying procedures to minimize animal suffering and improve their quality of life. Examples include improved housing conditions, providing enriched environments that cater to the physical and psychological needs of animals, such as larger enclosures, social interactions, and environmental enrichment. Non-invasive techniques. using less invasive methods for data collection, such as imaging techniques, to reduce pain and distress. By applying these principles, researchers can significantly reduce the ethical impact of their studies while still obtaining meaningful scientific data. A laboratory technician notices that several lab animals are showing signs of hyperactivity, excessive grooming, and a lack of normal social interaction. What could these signs indicate, and what steps should the technician take to address the issue based on the animal behavior guidelines? Answer: the signs described, such as hyperactivity, excessive grooming, and lack of normal social interaction, may indicate stress or anxiety in the animals. According to laboratory animal behavior guidelines, these behaviors could be triggered by various factors. Stress indicators: lab animals can exhibit stress through abnormal behavior, including repetitive actions like excessive grooming or changes in activity levels. Stress could result from inadequate housing conditions. Small cages, lack of enrichment, or inappropriate social conditions can cause stress. Invasive procedures, surgical procedures, or handling can lead to stress reactions. Environmental factors: unfamiliar environments, high noise levels, or improper lighting can disturb the animals. Steps to address the issue: the technician should assess housing conditions, ensure that the animals have enough space, enrichment, and appropriate socialization with conspecifics, review experimental protocols, examine the procedures to see if they are causing undue stress or pain, implement stress-reducing measures, consider alternative methods to reduce stress, such as adjusting handling techniques or using less invasive methods, consult with veterinarians. If the problem persists, seek advice from veterinary staff to rule out health-related issues. Following these steps aligns with the 3R's principle of refinement, as well as the ethical standards outlined by organizations like the Animal Welfare Actaway. Mr. Williams, a laboratory technician, is working with a group of laboratory rats in an experimental setting. One rat has displayed aggressive behavior towards others in the same cage, resulting in injury to the other animals. What immediate actions should Mr. Williams take to address this situation and prevent further aggression based on laboratory animal behavior guidelines? Answer: Mr. Williams should follow these steps to manage the aggressive behavior. Separate the aggressive animal. The immediate step is to separate the aggressive animal from the group to prevent further harm. Aggressive animals should not be housed with others until the behavior is addressed. Assess possible causes. Investigate possible causes for aggression, including social factors. The animal may be showing territorial behavior, or the group may not have been properly socialized. Health issues: illness or pain can trigger aggression. A veterinary checkup should be arranged. Environmental factors: overcrowded or inadequate living conditions can contribute to aggression. Modify housing or environmental conditions to reduce aggression. Ensure that there is enough space and proper socialization for the animals. Environmental enrichment, such as hiding spots and objects for manipulation, is provided to reduce stress. Monitor behavior. Mr. Williams should closely monitor the behavior of the remaining animals to ensure no further aggressive interactions occur and to assess the effectiveness of the interventions. How do the regulatory frameworks established by the USDA and FDA influence the design and conduct of animal research in the United States, and what are the key compliance requirements for researchers? Answer: both the USDA and FDA play crucial roles in regulating animal research. The USDA Animal Welfare Act regulates the treatment of animals in research, ensuring that researchers provide proper housing, food, and care. Compliance with AWA is mandatory, and non-compliance can lead to penalties. The USDA requires annual inspections of animal research facilities and mandates that animal use protocols be reviewed and approved by the IACUC. FDA. The FDA governs the use of animals in preclinical testing for drug development. Researchers must comply with good laboratory practice (GLP) to ensure the integrity of the data collected during animal studies. The FDA mandates that animal studies be ethically justified and that any adverse effects on the animals are minimized. Additionally, the FDA requires that alternatives to animal testing be explored wherever possible. Researchers must adhere to these regulations to ensure that animal studies are scientifically valid and ethically sound. Non-compliance with USDA or FDA guidelines can lead to serious legal and reputational consequences. Describe the ethical review process for animal research protocols. What factors must be considered when reviewing a protocol, and how does the IACUC ensure that the ethical principles are upheld? Answer: the ethical review process for animal research protocols involves several key steps to ensure that animal welfare is prioritized. Protocol submission. Researchers submit their proposed protocols to the IACUC detailing the objectives, methods, animal species used and anticipated outcomes, scientific and ethical evaluation. The IACUC assesses whether the research is scientifically justified and whether animal use is absolutely necessary. The IACUC must ensure that the THRIS principle is applied. Risk and distress assessment. The IACUC evaluates the potential risk and distress to the animals, ensuring that steps are taken to minimize harm and discomfort. Approval or modification. The IACUC may approve, request modifications to, or reject the protocol based on its ethical considerations. By following this process, the IACUC ensures that ethical principles are upheld in the design and execution of animal research. Why are socialization and enrichment programs essential for laboratory animals, and how can these programs improve the well-being and behavior of animals used in research? Answer. Socialization and enrichment programs are essential for promoting the mental and physical well-being of laboratory animals, particularly those housed in captive environments. Socialization. Animals, especially social species, require interaction with conspecifics, members of the same species, to maintain normal social behaviors. Socialization helps reduce stress and anxiety, promoting natural behaviors like grooming, play, and social bonding. Enrichment programs. Enrichment includes physical, social, and cognitive activities that provide stimulation and encourage natural behaviors. Examples include toys and objects. Items like tunnels, climbing structures, and chew objects provide physical and cognitive challenges. Positive reinforcement. Reward-based training techniques can enhance cognitive engagement and reduce stress. These programs are integral to refinement under the THRIS principle, reducing animal suffering and ensuring more accurate research outcomes by promoting natural behavior. Discuss the role of ethical standards and legal compliance in ensuring the humane treatment of laboratory animals. How do ethical standards intersect with legal requirements in the regulation of animal research? Answer. Ethical standards and legal compliance are critical in protecting laboratory animals from unnecessary harm. Ethical standards, such as those promoted by the IACUC, ensure that animal research is scientifically justified and that animal welfare is a priority. These standards intersect with legal requirements, including the Animal Welfare Act (WAP), which mandates humane treatment and care for certain animal species, the Guide for the Care and Use of Laboratory Animals, which provides a framework for best practices in animal care. Ethical review processes ensure that protocols are reviewed for scientific and moral justification, while legal compliance ensures that researchers meet national standards of care and treatment. How do regulatory standards influence the design and operation of laboratory animal facilities, and what are the key considerations for ensuring compliance with these standards? Answer. Regulatory standards for laboratory animal facilities, such as those outlined by the USDA and AALAC, Association for Assessment and Accreditation of Laboratory Animal Care, play a key role in maintaining animal welfare. Facility design. Regulations specify the minimum space requirements, ventilation, lighting, and temperature controls for various species to ensure optimal living conditions. Animal care. Guidelines require that animals receive appropriate food, water, and care based on species-specific needs. Staff training. Personnel must be trained in animal care, handling, and emergency procedures. Compliance with these standards ensures that animals are housed and cared for in a humane manner, promoting both their welfare and the integrity of the research conducted.